that, the data that we have thus far is there are multiple factors that put patients at higher risk for early onset that we've identified. I would have to say that it's not necessarily one specific reason to account for why young adults are developing early onset. We have seen associations between obviously alcohol use, between dietary habits, between metabolic syndromes such as diabetes and hyperlipidemia, et cetera. There's also been association, obviously, with the reduced physical activity and the impact for also recurrence in patients that have had a history of colon cancer as well with reduced activity. I would say, in short, it's multifactorial, but there's not necessarily one specific genetic link that we've been able to identify to account for this. And I think at the end of the day, what you'll find out is it's likely multifactorial. There's even data, obviously, geographically that shows whatever state you may be in, you're more predisposed to developing early onset. You can see the transition, at least in the United States, from 10, 15 years ago, and the geographic distribution of early onset and how that has, unfortunately, many parts of the country are more impacted than others. I live in a region that is very susceptible to early onset, but it is also, these are individuals with very different dietary habits than somebody that lives in Denver, Colorado, or somewhere where there's more activity, physical activity, and probably less body fat than my geographic region. I think it's a very nice article because we have seen a lot of information about the data within the United States, and then you hear some general information from the EU and as well as in Asia. But here we're talking about, multiple different countries where there's a rising incidence. And I think that is really important to take into account. And also countries that we often wouldn't think about, they mention like Ecuador and Chile and Croatia. And I think that is also really interesting and informative because this type of information can be preventative for these countries that are now seeing a rise. And I like the fact that they're also looking at it, differences between men versus women. I think that's very, very helpful. This kind of information, I know not all journals favor these kind of generalized information, but I find it, especially for someone that gives a lot of lectures on early onset and really trying to focus on acknowledgement that this is an issue. These are, what the symptoms are, how do we get diagnosed? So I really try to take this data and use it more for preventative purposes. So I would hope that others will, it is in Lancet Oncology, so unfortunately it's probably going to be mostly oncologists that are reading it. But I hope this data gets out, obviously, to our primary care physicians and to our family practitioners and to our mid-level providers, although I don't know, not all countries use mid-level providers such as APPs as much as the United States, I would say. But I think that, to share that information, get the information out and acknowledge that this is an issue, and especially in these countries that maybe have never thought about it. There's obviously a lot of ongoing research to see how we can identify other environmental factors that may be accounting for why this is happening. But I think that's obviously going to be a long-term process. There's a lot of interest in the microbiome, as you know. Once again, that's also involving exposures. A lot of that, a lot of this involves the exposome, which is looking at all aspects from when you're, as a fetus to development and how that may put you at risk. And none of that's really been identified. A lot of people are interested in it. But as a physician, more for the preventative purposes, we know that the recommended age for screening in the United States is 45. I think we still need to, that's new since 2020. And I think people need to continue to recognize that they need to learn about their family history, which could account for some of these patients, although that's a smaller minority of patients. We need to identify basically patients that may be younger than 45 and what the symptoms are, so their doctor knows to send them for screening. And I think that that's really one of the major aspects, because a lot of our patients that are coming to us currently have more advanced disease, because they are presenting later. They often look quite healthy. And so either they delay their diagnosis because the patient themselves may not be aware that something is really wrong, or they may have been misdiagnosed by a provider because they are much too young to have what they presume would be the age for colorectal cancer, which the median age is 67. So there's a big discrepancy there between the patients that are presenting in our clinic. So we're presuming, they said in 2023, it's about 20,000 individuals that are going to be diagnosed, that have been diagnosed with early onset colorectal cancer. And that number obviously is going to go, it's expected by 2030 to be significantly higher. So I would say the way to prevent it, obviously, is to recognize the symptoms, learn about your family history, and I think those are the most important things we can do right now. And, I can't tell you what for sure would be preventative other than try to lead a relatively healthy lifestyle. However, I've had patients that have led healthy lifestyle and still have early onset colorectal cancer. So that's why I know for sure it is multifactorial.